Hey, what's up everyone? Nurse Jar here. Welcome to my YouTube channel. If you have not yet subscribed, please go ahead and kick that subscribe button. Hit the like button on this video and any other video that has been helpful to you. You doing so actually helps my channel to become more recognizable here on YouTube and in Google search. And if you like to be notified whenever I upload new content or go live, go ahead and ring that notification bell. In today's training video, I'll be demonstrating the 2026 Prometric Testable Skill Partial Bed Bath and Back Rub. Now, so some of the most commonly forgotten steps is the removal and disposal of the nightgown, okay? Don't forget to do that. Just think about when you take a shower or you take a bath, you don't jump in there with your clothes on, right? You take your clothes off. The same thing has to happen with this skill. You must remove and immediately dispose of the hospital gown into the soiled linen hamper. If you remove it and just set it on the bed or the overbed table, you're not going to get credit for the step. You remove and immediately dispose of. Another commonly incorrectly performed step is when you clean the face, the person or candidate does not start with cleaning the eyes. Let's go ahead and get started with the skill. Yes. All right, guys, as always, with each bedside skill, you must start by performing the opening procedures first. Hi, Mrs. Jones. I'm Julie, your CNA, and today I'll be giving you a bed bath and a back rub, okay? Before I get started, I just want to make sure your bed is in a low, safe position, and it is. Your bed wheels are locked. I'm going to place your call light within reach, and I'm going to provide you with privacy. Mrs. Jones, before I go wash my hands and gather my supplies, is there anything I can do for you? All right, I'll be right back. Washing hands. All right, guys, so whenever you collect supplies, it's always good to collect your clean barrier first and place it on the overbed table. And then once you get this placed, you can gather the remaining items and place them on top of your clean barrier on your overbed table. All right, so now that I have my clean barrier, what I like to do and how I train my students is to organize your supply items on the overbed table in the exact order in which you're going to use them, right? Now, you don't have to gather them in this fashion, but when you actually start organizing them, placing them on the table, you'll want to. So I have my bath basin. I'm going to get one towel, right? Pair of gloves. Place that here. I'll need a privacy blanket. Place that there. 5 washcloths. And another towel to dry. So you're actually going to collect 2 towels. I'm going to place a washcloth here. That's the one I'm going to use for my face, or the mannequin's face, not my face. 2 washcloths here and another 2 washcloths here. Okay, so 5 washcloths total. And I'm going to grab some soap, place it here, lotion, and a clean hospital gown. I'm just going to place this underneath the towel. So I should have 14 items in total. Let's go ahead and count. I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and 14 items. All right, and as I said, I've organized them in the exact order in which I'll have to use them. Why do you want to do this? Well, it will help cue you as to what step comes next. And 2, it will also help you recognize whether or not you forgot a supply item or you have one too many of something. Just as with you knowing how many supply items to collect. First thing that I have is the basin. What should I do with this basin? Y'all got it. Go fill it up with some water. So come on, what y'all waiting on? Come on. All right, guys. Now, you are required to test the temperature of the water first and then allow the resident to test it. You can either test it while you're at the sink filling the basin, or you can wait till you get back to the bedside to test it. You can test with ungloved hands or with the gloved hand, gloved finger, the underside of your wrist or your elbow, okay? So the first thing that I'm gonna do, of course, y'all know, turn on that water, right? And I like testing my water while I'm filling the basin. When you do so, please make sure you verbalize out loud that you are testing the water. I'm testing the water. Okay. And now I'm going to fill my basin. And I'm going to go ahead and turn off the water, and then I'm going to allow the resident to test the water. Mrs. Jones, I've tested the water. It feels okay to me, but now I'd like for you to test it to make sure it's a good temperature for you. Awesome. I forgot to tell y'all, your skills instruction card will have which arm you'll need to clean, right? So it's either going to be the right arm or the left arm. Please clean the correct arm. If you have to, position yourself facing the same direction that the mannequin is. That way you can say, oh, okay, this is the right arm, so I need to clean this arm over here. Or the left arm, I can stay on this side of the bed and clean this arm, okay? So for training purposes, since I'm already on this side of the bed, we're just gonna say that my skills instruction card said that the left arm needs to be clean. One thing that I want to tell you, if the water in your basin becomes excessively soapy or sudsy, you'll have to empty it out into the sink, rinse it, empty the rinse into the sink, and then fill it up again with fresh, clean water. So try not to let the water in your basin become soapy, okay? So now the next thing that I'm gonna do, Prometric is huge on body mechanics. So whenever you're performing a bedside skill, whenever you need to raise the height of the bed to a comfortable working level for you, please do so. Mrs. Jones, I'm going to go ahead and raise your bed to a comfortable working level for myself, okay? You're going to feel the bed rising. All right, I think that's good. And so the next thing that you'll want to do, because I'm going to be cleaning this hand, I'm just going to go ahead and remove the call light. Of course, everything that I'm doing, I would be, verbalizing that to the resident. But since I'm training you all, I'm talking to y'all. But just know that you need to communicate with this mannequin. I'm just going to place it back there. Any other time, I would actually leave the call light in place if I didn't need to manipulate the person's arm or, the upper body. But because I do, I just went ahead and removed it for this skill. Okay. Now that I have the bed to a comfortable working height for myself, the next item that I have on my overbed table is the privacy blanket. So that lets me know right now is the time for you to place that privacy blanket. So that's what I'm going to do. I'm going to cover her from chest down to over feet. All right, once I have the privacy blanket in place, I'm going to go ahead and do this, making sure I do not overexpose the resident. But once I get it done, for training purposes only, I'm going to lower the privacy blanket so you can see how I have that top sheet positioned. Mrs. Jones, I'm just lowering your top sheet, okay? Making sure I do not overexpose you. There we go. All right, guys, now I'm going to lower this privacy blanket so you can see, okay? See how I have the top sheet lowered to hip level? That's where you'll want it to be, okay? Do not do this in testing, though. Uncover the resident, okay? Do not overexpose the resident during testing. Now, the next thing I'm going to do, which is one of the most commonly forgotten steps, is the removal and immediate disposal of the hospital gown. You can do this in one or two ways. You can either manually sit the mannequin up. Basically, you're going to place one hand behind her shoulder blade. You're going to place your other arm. You're going to use this arm as a bridge, right, to hold that privacy blanket in place. You're going to give the resident a cue such as 1, 2, 3, and then lift the resident. Mrs. Jones, on the count of 3, I'm going to sit you up, okay? 1, 2, 3. Just like that. And you see how I'm using this arm as a brace to keep the privacy blanket in place. And then you can go ahead and untie and remove the gown. Another way you can do this, which to me is the most convenient and easiest way and less time consuming way, is just reaching your hand underneath the resident's neck and untying the gown. Once I've done that, without overexposing the resident, I'm going to remove the sleeve off of one arm and then off the other arm, making sure I do not overexpose the resident. And then I'm just going to bring the gown towards my side of the bed. And as you notice, I did not have to lift the resident's arms up, okay? If you do lift the resident's arms, just make sure that, you know, you're supporting that arm underneath the joints. And then I'm going to pull the gown towards me and roll it away from me at the same time. And immediately dispose of it into the soiled linen hamper. Again, once you remove this gown, do not set it on the bed. Do not set it on your over bed table. Do not set it on the bedside stand. Do not set it down anywhere. You must immediately dispose of it into the soiled linen hamper. All right, so now what I'm going to do is expose the arm that I'll be cleaning, which is the left arm. Okay. And then the next item that I have is the towel that I'm going to use as the linen protector. I'm going to open it up and I'm going to place it underneath the mannequin's head. I'm just going to lift her up. I have my hand behind her back, her upper back, and I'm lifting her up, making sure that the towel will be on both sides of the head and underneath the arm. Just like so. All right, guys, the next supply item that I have on my table are my gloves. So this is letting me know that right now is the time for you to put on gloves, right? Now I get asked this question a lot. You know, is it okay if, you know, I put my gloves on, you know, before I place the privacy blanket? Yes, it is okay, all right? If you think that you are going to forget to don your gloves before you actually start cleaning the person, then by all means, please, like after you know, fill your basin with water, test it, and have the resident to test it, you can put on your gloves. Prometric requires you to be wearing gloves before you actually touch that first washcloth to wash the person's face, okay? So that's what I'm going to do now. I'm going to take my first washcloth. I'm going to wet it. Again, for this first washcloth, you do not apply soap because you're going to be cleaning the resident's face. If you accidentally do apply soap to this washcloth as you are going to clean the resident's face, the nurse aide evaluator will tell you to stop and to get a new washcloth. This should let you know that, oops, I must have placed soap on this washcloth, okay? So as y'all can see, for this first washcloth, I did not put soap. I have it folded into fours, and I'm going to hold it in my hand to where I have the 4 open leaves on top, okay? You are required to start cleaning the face beginning with the eyes. So again, I'm going to clean from inner canthus to outer. Flip the washcloth over to a clean area. Inner canthus to outer. Flip the washcloth over to a clean area. I'm going to clean one side of the face. Flip over to a clean area and clean the other side of the face. And then I'm going to turn the washcloth to where I have the closed leaf, right? Just one leaf. I'm going to clean one side of the bridge of the nose, and then I'm just inverting the washcloth to a clean area and cleaning the other side of the bridge of the nose. And voila, you are done cleaning the face. And now that I've washed the face, I'm going to pat dry the face. This is one of the most forgotten steps or omitted steps. All right, now that I'm done cleaning the face, I'm going to place this soiled washcloth over my basin. I like doing it this way, okay? But you can also make a dirty area on your overbed table and place your washcloth on the overbed table, okay, away from your clean supplies. I just like placing it over my basin, okay? Now, the second washcloth, I'm going to wet it and apply soap. I'll be cleaning behind the ears, the torso, both flanks, and the required arm, hand, and underarm. So I have my washcloth folded into fours. I'm going to fold it to where I have the open leaves on top, right here. I'm going to clean behind both ears. So I'm cleaning behind one ear, flip over to a clean area of the washcloth, clean behind the other ear. And now I'm going to clean the neck, torso, the flanks, and the required arm, hand, and underarm. Taking my second washcloth, I'm opening it up and I'm going to apply soap to all areas of the washcloth. I'm going to rub it together to create lather. And then I'm going to fold it into fours. All right, so I'm cleaning the neck, the chest underneath the breast, one flank, the other flank, and then the one required arm, hand, and underarm. And you do not have to use, a different area of the washcloth when you're cleaning the person's hands. Now, when you clean the underarm, you want to make sure you get in that armpit, okay? And verbalize, I'm cleaning the armpit, or I'm cleaning underneath the arm. I'm going to go ahead and rinse in the same manner the same areas that I just washed. Now, during testing, the nurse aide evaluator, while you're washing and possibly while you're rinsing, she is going to ask you to lower the sheet. It is at that time and that time only where you'll expose the resident or the mannequin. And the reason she or he is having you to do this is because they need to see how you are cleaning or rinsing, okay? But do not overexpose that resident until you have been instructed by the NAE to do so. All right, so I'm going to place this washcloth on my basin. I'm going to get this third washcloth. I'm going to wet it, and then I'm going to rinse in the same manner that I washed the area that I just did, okay? So I'm going to rinse behind one ear, flip to a clean leaf, rinse behind the other ear, and then rinse. And I'm going to go ahead and overexpose so you can see what I'm doing, okay? So I'm cleaning or rinsing the neck, the breast. If you like, you can also like act like you're lifting up the breast to clean underneath the breast, but that's not required. Cleaning one flank and then the other flank, that's just the sides of the abdomen. Then I'm rinsing the arm. Now, if you have soap that gets stuck in the crease, don't worry about that, okay? Because we have, as humans, we don't have creases in our arms. And then NAE knows that. Okay, clean. And then I am rinsing, sorry, I keep saying clean while I'm rinsing. Rinsing between the fingers, making sure I remove all the soap. The hand, there we go, the arm and the underarm. Again, when you wash, rinse, and dry the armpit, you have to get up underneath that arm, okay? I've washed and rinsed, you know, behind the ears, the neck, the torso, flanks, and the one required arm, hand, and underarm. I'm going to dry. And what I'm going to do, I'm going to use the linen protector, right, to dry behind the ears. There we go. Dry behind the ears. And then I'll use my second towel to pat dry the neck, chest, flanks, and tummy. Okay, and I'm going to overexpose her so you can see what I'm doing. Do not overexpose her during testing until you are instructed to do so by the nurse aid evaluator. I'm doing it now for training purposes only, so you just, you know, so you can see what I'm doing. And then I'm going to pat dry the arm, or again, you can use the towel that you're using as, you know, as the linen protector, okay, to dry the arm and stuff. All right, there we go. Make sure that underarm is dry. Good. All right, guys. So now that I'm done, I'm going to recover her arm. Okay, now it's time to clean the back of her neck, her back, and give her that well-deserved back massage. All right, guys, because Prometric does not emphasize the use of the side rail, before you turn the resident onto their side, you'll need to manually move them closer towards you and then turn. That way, after turning the resident, the mannequin won't be dangerously close to the edge of the bed, okay? All right, Mrs. Jones, so what I'm gonna do right now is just move you closer towards me and then turn you onto your side, okay? On the count of 3, I'll move you towards me. 1, 2, 3. There we go. You want to try to make sure that you move the mannequin as a unit, okay? Once I have the mannequin close to my side, I'm going to just place her arms on her tummy, and I'll show you. I'm going to overexpose the mannequin so you can see, okay? I have the mannequin's arms on their tummy out of the way, all right? And then I'm going to flex her knee. I'll expose her so y'all can see what I'm doing. I'm just flexing her knee, and I have it like at a 90-degree angle, okay? Because this knee is actually going to keep her anchored on her side. We cover her back up. All right, Mrs. Jones, on the count of 3, I'm going to turn you onto your side. 1, 2, 3. Turn. There we go. And you see how this knee keeps her anchored on her side? Now, if you're having difficulty maintaining the mannequin on its side, right? Usually, if the NAE sees this, he or she will just come over and, you know, hold the mannequin in place for you. But if they don't, you know, don't waste time trying to, like, you know, figure out how to keep the mannequin on the side. All you have to do is ask the nurse aid evaluator to come assist you with holding the mannequin in place. Okay. Now that I have the mannequin on its side, I'm going to expose the back. Okay. Just the back area. And then I'm going to move the linen protector underneath the back. Okay, which is the towel. I'm going to take my 4th washcloth, wet it. I'm going to open it up completely. I'm applying areas. I'm applying soap to all areas of the washcloth. Rubbing it together to create lather. I'm folding it back into 4s. Okay. And then I'm going to clean the back of the neck and the back. And a little trick, I don't know if y'all can see, but you can see the suds on the mannequin's back. That's what the NAE wants to see. If they do not see suds, a little trick you can do is while you're cleaning, just like gather up the washcloth and just squeeze it a little bit, right? You see these suds coming up, squeeze it a little bit. Now you have more lather, okay? So once I clean the back of the neck and back, I'm gonna take my 5th and last washcloth. I'm gonna wet it, squeeze it out really good. Do not apply soap to this washcloth. I'm just keeping it in all 4s. And then I'm going to rinse the back of the neck and the back, the areas that I just cleaned. Okay. Again, you can use that 2nd washcloth to pat or blot dry the back of the neck and back, or you can use the towel that you're using as a linen protector. Okay. Once I've done that, I'm going to get my lotion, right? Just a little dab of lotion in the palm of my hands. You need to rub it together. Why are you rubbing your hands together? Why? I'm asking y'all. Do you know? To warm the lotion. Okay. Once I do that, I'm going to give the back rub. Okay. And basically what I'm doing from the sacral area up to the shoulder blades in an upward circular motion, I'm going to do 3 passes. Okay, just like that. All right, here we go. That's 1, 2, and 3. Okay, that's the back rub. I'm going to use this towel that I use as the linen protector, and I'm going to remove any excess lotion by pat drying. Okay. Another commonly omitted step is the removal of this towel. So I'm going to remove it while I still have her turned on her side. I'm going to place it on my overbed table, and then I'll reposition the resident onto their back. Mrs. Jones, on the count of 3, I'm going to turn you back on your back, okay? 1, 2, 3. Awesome job. Get your legs straightened out here. Make sure I do not overexpose you. On the count of 3, I'm just going to move you back to the middle of the bed, okay? 1, 2, 3. Awesome job. Okay. And now it's time to place the clean hospital gown. So I'm going to manually unfold it. Please do not shake it open, people. Okay. Once I get it unfolded, I'm going to expose this arm. And the best way you can, just put that arm in the sleeve. And you can see I'm placing the gown over the privacy blanket. I'm going to come on the other side and place the gown in the right arm. Just going to expose this arm. Again, the best way that I can, I'm placing this gown. Okay, again, you know, you can either set the resident up, tongue-tied. You can either manually sit the resident up, 1, 2, 3, use your opposite arm as a brace, right? And then tie the gown like I'm doing right now. And do not tie it in a knot, okay? Tie it in a bow, right? And then on the count of 3, lay the resident back, 1, 2, 3. There we go. Or you can just reach underneath and tie the gown. So 2 different ways how you can remove the gown or untie the gown before removing, and tying the gown after placing the clean gown, okay? And then once I do that, I'm just gonna remove the privacy blanket and raise the top sheet back to chest level. There we go. And then I'm going to completely remove this privacy blanket and dispose of it into the soiled linen hamper. Making sure it does not come into contact with my clothing. While I'm here, I'm going to grab my soiled linen, dispose of it into the soiled linen hamper, making sure it doesn't come into contact with my clothing. And then since I got the soap and lotion right here, I'm going to replace that back into storage. And now I'm going to empty, rinse, and dry my basin in the sink. But before I do that, I'm going to go ahead and remove this clean barrier. Make sure my table is still clean and dry, and it is. I'm going to dispose of my clean barrier into the waste bin because I used the Chuck's pad. If you use a towel, please dispose of it into the soiled linen hamper. Okay, so I'm emptying the basin into the sink, and no, you do not have to empty it into the toilet or bedside commode. This container did not contain any body fluids, okay? I'm going to empty the rinse into the sink. Again, you do not have to empty the contents or the rinse into the toilet or bedside commode. Why? Why not? Tell me. Y'all got it? Because this container right here did not and has not contained any body fluids. All right, so I'm drying the basin, and please, any container that you use for any skill, make sure you dry it completely on the inside and out, because there are some NAEs, right, who will actually, once you state skill complete, will go into that storage bin and look to see if it's completely dry. Once I have it completely dry, I'm going to go place it back into storage. I'll remove my gloves without contaminating myself. Immediately dispose of them into the waste bin. Immediately verbalize hand hygiene or hand washing, washing hands. And now I'm gonna place this table back. It's still clean and dry. I'm just gonna straighten out her sheets. Mrs. Jones, I'm just gonna straighten out your sheets for you. I'm gonna give you back your call light. There we go. Make sure it's within reach. There we go. Your bed wheels are still locked. I'm just going to lower your bed to a low safe position. Would you like for me to open your privacy curtains, or would you like for them to remain closed? Open? Okay. There we go. We'll get these open for you. All right, Mrs. Jones, we are all done. Before I leave for the day, is there anything I can do for you? Would you like some water or juice or a snack? All right, are you comfortable? All right, Mrs. Jones, well, you have a good day, okay? All right. Washing hands, skill complete. All right, guys, that's it. Partial bed bath and back rub. But now, yes, I got a treat for y'all. I'm going to perform this testable skill in its entirety, the exact way that you should perform it during testing if you are required to perform this skill. So sit back and watch. Hi, good morning, Mrs. Jones. I'm Julie, your CNA, and today I'll be giving you a bed bath and a back rub, okay? Before I get started, I just want to make sure your bed is in a low safe position, and it is. Your bed wheels are locked. I'm going to place your call light within reach just in case you need me for anything, and I'm going to provide you with privacy. Mrs. Jones, before I go wash my hands and gather my supplies, is there anything I can do for you? All right, Mrs. Jones, I'll be right back. Washing hands. All right, I'm going to use a Chuck's pad as a clean barrier to place on my overbed table. Then I'll collect the remaining supply items, which is a basin. Let's see, I'll need 2 towels, 5 washcloths, a hospital gown, lotion and soap, 1 pair of gloves, privacy blanket, and I think that is it. Let's see, I have 1, 2, 3, 4, 5. That's 10, 11, 12, 13, 14. All right, Mrs. Jones, I have all of my supplies. What I'm going to do right now is just go fill the basin with water, and I'll be right back, okay? I'm testing the water. Mrs. Jones, I've tested the water. It feels good to me. I'd like for you to test it to make sure it's okay for you. Awesome. Before I get started, Ms. Jones, I'm just going to raise the level of your bed to a comfortable working height for myself, okay? There we go. And while I'm doing that, I'm just going to remove your call light. I promise to give it back to you, okay? Okay, there we go. Right, just going to place your call light here, and I'm going to place a privacy blanket on you, okay, just to make sure I keep you covered and not overexposed, and also to keep you nice and warm. Just making sure I cover you from chest down to over feet. And then I'm just lowering your top sheet, okay, to hip level so it won't get wet. Okay, I'm going to remove your hospital gown. Okay, then I'm going to remove it from this arm. Okay, we'll get this arm covered back up. Then I'm going to go ahead and completely remove it, rolling it up in a ball, making sure it does not come into contact with my clothing, and immediately dispose of it into the soiled linen hamper. Mrs. Jones, I'm just going to expose your arm and I'll be placing a towel underneath your arm, okay, just to protect your sheets. I'll also place it underneath your head. On the count of 3, if you can raise your head for me. 1, 2, 3. Awesome, you're doing good. There we go. All right, I'll straighten up your head for you. Okay, and keep that arm exposed because I'll be cleaning your left arm, okay? Now I'm just putting on my gloves. And after I put my gloves on, I'll clean your face, okay? All right, so I'm just taking my first washcloth, wetting it. I'm not applying soap. I'm gonna keep it in all 4s. All right, Mrs. Jones, I'm gonna clean your face starting with your eyes, cleaning from inner canthus to outer, flipping over to a clean area of the washcloth, cleaning from inner canthus to outer, flipping over to a clean washcloth or leaf, cleaning one side of your face, flipping over to a clean area of the washcloth, cleaning the other side of your face. With the clean area of the washcloth, I'm going to clean one side of the bridge of your nose, flipping it over to a clean area, cleaning the other bridge of your nose, or the side of the bridge of your nose. I'm going to take my towel and pat dry. There we go. I'm going to take my second washcloth, wet it, open it up completely, and apply soap to all areas of the washcloth. Here we go. Just rubbing it together to create lather. Okay, I'm going to fold it into 4s. I'm going to clean behind one ear, clean behind the other, and then I'm going to clean your neck, chest, and flanks. Clean one arm, hand, in between your fingers, and your underarm. I'm going to take my third washcloth, wet it. I'm not applying soap. I'm going to rinse behind one ear, flip over to a clean area, rinse behind the other ear, and then I'm going to rinse your neck, chest area, flank, and one arm, in between your fingers, your hand. Make sure I remove all soap, and underneath your arm. Okay. I'm just going to dry behind your ears. There we go. Dry behind this ear. And I'm going to dry your arm, in between your fingers. There we go. And underneath your arm, or your armpit. Okay. And then I'm going to dry your neck, and your chest area, your tummy, and your flanks. Gonna recover this arm. Mrs. Jones, I'm gonna get ready to clean your backside or your back. So before I do, I'm just gonna move you closer towards me, and then I'll give you a cue to turn you on your side, okay? All right. I'm just gonna place your arms on your tummy so they can be out of the way. Okay, on the count of 3, 1, 2, 3, move you closer towards me. And then I'm just gonna flex your leg. Okay, and then on the count of 3, I'm gonna turn you. 1, 2, 3. There we go. Good job. Okay. Just going to expose your back. Make sure I don't overexpose you. Just moving the towel up underneath your back. Make sure I don't get your sheets wet. I'm going to take my fourth washcloth, wet it, squeeze it out really good, open it up completely, apply soap to all areas of the washcloth. Rub it together to create lather. I'm going to fold it into fours. I'm cleaning the back of your neck and your back. There we go. I'm going to take my fifth and last washcloth, wet it, squeeze it out really good. I'm not applying soap. I'm just rinsing the back of your neck and your back. There we go. Then I'm just drying the back of your neck and your back. Okay. All right. Now I'm just going to give you your back rub, Miss Jones. I'm just applying lotion to my hands and rubbing my hands together to warm the lotion. And then we'll get you that massage, okay? It's 1, 2, and 3. I'm going to remove any excess lotion. There we go. And I'm going to remove this towel. And then on the count of 3, I'm going to turn you back onto your back, okay? 1, 2, 3. There we go. You can straighten your leg out for me. You're doing an awesome job. There we go. Let's get your arm back down here. All right. And then on the count of 3, I'm just going to move you back to the middle of the bed, okay? 1, 2, 3. You're doing good. Okay. Now we're going to get a clean gown on you, okay? Just opening it up manually, making sure I do not shake it open. Just going to expose your left arm, place it in the sleeve. Okay, and we'll walk on the other side of the bed. I'm going to expose your right arm, place it in your sleeve. There we go. Then I'm going to tie your gown, okay? There we go. And tie it in a nice bow. I'm going to lower this privacy blanket. There we go. And we're going to raise this top sheet. I'm just removing the privacy blanket and I'm going to dispose of it, making sure it does not come into contact with my clothing. I'm going to dispose of my soiled linen into the soiled linen hamper, making sure it does not come into contact with my clothing. I'm going to place the lotion and soap back in storage, and then I'm going to empty, rinse, and dry the basin. Dispose of my clean barrier. I'm going to empty the basin in the sink, rinse it, empty the rinse in the sink. And I'm going to dry it, make sure I dry it completely on the inside and out. And then I'll replace it back into storage. I'm going to remove my gloves without contaminating myself. Immediately dispose of them into the waste bin. Washing hands. All right, Mrs. Jones, I'm just placing your overbed table back where I got it from. We're all done. Your bed wheels are still locked. I'm just going to put your bed back into a low safe position. I'm going to place your call light within reach. There we go. Would you like for me to open your privacy curtain, or do you want them to remain closed? Open. All right, Mrs. Jones, we are all done. Let me just straighten your sheets out a little bit more for you. There you go. Before I leave for the day, is there anything else I can do for you? Would you like some water or a snack or a magazine? No? Are you comfortable? All right, Mrs. Jones, well, you have a good day, okay? All right. Washing hands, skill complete. Whew. Oh my goodness, that was a lot, guys. Okay. So you got this 2-part video. The first part, I'm explaining everything to you step by step by step by step by step. The second part of the video, I'm performing this skill in the raw, exactly how you will want to perform it during your Prometric skills exam. Guys, I hope y'all are enjoying these newly updated 2026 Prometric training videos. If y'all are, show it, okay? And like this video, okay? Like it, all right? Hey guys, I got TikTok now, okay? Go to my TikTok page. It is the Real Nurse Jar, and follow me. I also have paid subscriptions for $2.99 a month. You know, I'm just getting started with this TikTok thing, right? So I'm learning as I go, but I would really appreciate your support on my TikTok channel. The way y'all are supporting me here on YouTube, go to the Real Nurse Jar on TikTok and support me there too. I love y'all. Y'all know I love you. I love you, love you, love you. Mwah. Ciao.